Swadika and good afternoon, and welcome back to the English language summary of the daily press briefing on the COVID-19 situation in Thailand, live from the Center for COVID-19 Situation Administration, or the CCSA. Today's briefing is for Monday, the 28th of June 2021. And since we don't have press briefings on the weekends, I'll be giving you a roundup of the general situation in the past 2 days and the new measures issued over the weekend, which was a result of the Prime Minister's consultations with his panel of independent experts last Friday. But let me first start with an update on the number of vaccines that have been administered since the start of our vaccine drive. So you'll be seeing on the screen very shortly the latest statistics. So as of yesterday, Sunday, the 27th of June, Thailand has already administered over 9.1 million doses of vaccines. And out of this number, 6.5 million persons have already received their first doses, and 2.6 million have already received their second doses. And this is the equivalent of 12.69%, so nearly 13% of the whole population. You might have already seen in the news that over the weekend that we've received an additional lot of AstraZeneca and Sinovac vaccines over the weekend, and these will be distributed all over the country to move forward our vaccine drive as planned. So over the weekend, the overall situation is still quite worrying. It's been marked by 1 fatalities on Saturday and 42 on Sunday, respectively. And the same can also be said of the infection rates. For today, I have the following infections on the screen. Today, we have new confirmed cases standing at 5,406 cases. 9 of those are from penitentiaries. So it appears that the cases in state penitentiaries are improving. We have in total right now 45,648 active cases being treated at medical facilities. And 1,806 people are in critical condition, while 510 are on ventilators. We have today reported 3,343 persons who have recovered. And so this brings us of total number of recoveries standing at 202,271. We have today the new number of fatalities standing at 22, and the accumulated total of fatalities today stands at 1,934 cases. And the overall fatality rate in Thailand remains around 0.77%, which is still lower than the global average of 2%. So moving along, we'll be showing now on the screen a slide on the 10 provinces which have reported the highest number of COVID cases today. And this was also included during Dr. Tawisin's briefing just now. So Bangkok again has the highest number of cases at 1,678 cases. And there are also now 111 clusters of infections that are under surveillance by the public health authorities. And some former clusters of infections in Bangkok have also been cleared safe. So this indicates a progress of the measures that have been implemented, also in tandem with cooperation from the public and the local communities, and also all sectors of society within those areas, which means that these measures do work. So Tak has reported now 453 cases. Samutprakan is third at 395 cases. Nonthaburi has 390 cases. Samutsakhon 295, Songkhla 275, Nonthaburi 222, Nakhon Pathom 197, Pattani 178, and Narathiwat at 157 cases. So I will now talk about the new restrictions in Bangkok. Because last Friday, the Prime Minister met with his panel of independent experts that I mentioned to you last Friday as well. He discussed the necessary measures to address the recent surge of infections in Thailand, particularly Bangkok and surrounding provinces, and also some southern provinces of Thailand. And the Prime Minister made an executive decision to issue these new restrictions in Bangkok and 9 other provinces, so in total 10 provinces. The targeted COVID control measures have become necessary as Bangkok metropolitan region and its vicinities are at risk of developing a public health crisis, which is quite evident from the recent surge of new infections and the number of patients admitted to hospitals. There is no such lockdown, as many media outlets have falsely reported, but there are new restrictions in place, and these restrictions are to directly and immediately address the problem areas, and so they're very targeted, and we hope that these will effectively curb the spread as soon as possible. So I'd like to give credit to the infographic that we have on the screen right now, which is from the Bangkok Post. So the new measures, which will be implemented for 30 days and are effective as of today, will be implemented in the following provinces within the dark red zone. Of course, this is Bangkok, Nakhon Pathom, Nonthaburi, Pathum Thani, Samutprakan, Samutsakhon, Narathiwat, Pattani, Yala, Songkhla. And so the measures are, to name the most important ones, restaurants are allowed to provide only delivery and takeaway services. Shopping malls and shopping centers can only open until as late as 2100 hours or 9 p.m. Hotels and convention halls can open as usual, but no conferences or large gatherings can be organized. Social gatherings are permitted for up to 20 participants. Those events for larger gatherings than 20 will have to seek prior permission. Construction sites and worker camps will be sealed off to contain clusters of infections because they have been proven to pose risks. And this is because, like I said earlier, most of the cases have originated from construction camps, and these will include all construction camps within these 10 provinces, 9 provinces plus Bangkok. However, the authorities will be working closely with with the construction companies to provide necessary assistance to workers who are sealed off, and they will also receive compensation pay. And also, Dr. Tuisin also answered a question about factories. Will they be closed as well? So he responded that factories can continue to work as usual, but with disease control measures in place, and if those factories are identified as problem areas, they can continue to work under a bubble and seal as a preventive measure. So work can continue, but within that sealed bubble. Also, Bangkok Metropolitan Administration has announced 6 additional proactive COVID-19 testing service centers for the 28th to the 30th of June. And these will be in 6 districts. These are Sampantawong, Sai Mai, Minburi, Watana, Bangkok, Bangkok Yai, and Bangbon. So the public who wish to have COVID testing can proceed to these new centers. And also, Dr. Tuisin mentioned that this morning the Prime Minister called for a meeting of the government's economic team to discuss and map out relief measures for those affected by the latest wave of COVID-19 infections, and more importantly, the necessary public health measures put in place. And we will provide an update of these measures to you soon. Some will have to be tabled at the cabinet meeting tomorrow, but the Prime Minister himself is probably giving a press briefing right now to summarize the initial measures. And since Bangkok has become the epicenter for new infections, the CCSA has also requested Bangkok Metropolitan Authority to set up checkpoints at major thoroughfares throughout Bangkok to reduce interprovincial travel for only essential purposes. That there will be several checkpoints in several areas, and these will include Vipawadi Rangsit Road in front of Don Mueang train station, Suwintawong Road under Mahanakhon overpass, Bang Natrat Road in front of Bangchak petrol station, Brom Ratchathani Road under the Brom Ratchathani Puthamonthon Sai 3 overpass, Petra Kasem Road in front of Nong Kham District Office, and Ramo 2 Road in front of the PTT petrol station, Bang Khun Tien District. And these checkpoints will start operating today at 4 p.m. So please take this into account and add in additional traveling time should you need to travel through these areas. We understand that the new measures in place have been announced quite suddenly, but such is the nature of this pandemic, where changes can happen very quickly over a course of a few days, as well as an occurrence of new incidents of index cases can cause emergence of infections quite suddenly. And therefore, any measures we have issued are based on calculated decisions and are designed to help curb the spread of the virus as soon as possible, while allowing the public to maintain a somewhat normal life as much as possible too. And so this can only be possible, again, with the cooperation of all sectors of society, as well as you, the public, the kind audience who have been patient and understanding to us throughout this time. So before I close my briefing today, allow me to draw your attention to this infographic from the World Health Organization on how to properly wash your hands and also to keep DMHTTA. I'd like to thank you very much for your kind attention today. That's all I have for you. See you again tomorrow. ขอบคุณค่ะ สวัสดีค่ะ
ครับขอบคุณนะครับ